That's a short summary. But one day we're going to get there, and once this document is published, it'll probably be published in quite a number of journals in all languages, and then it will start to become a pattern of practice, accepted pattern of practice, and then we can do a better job of educating our physicians. Because our family docs and our specialists mostly don't know what to do. This is new ground for them. We've got to educate them too. Most of them don't have the ego that they're willing to learn from you. They should have, but they don't. So we've got to be patient, and we've got to get them taught, and we've got to get a bigger hammer from studies published on consensus document from people around the world. There was a fair number of Americans, a number of Russians, Poles, you Canadians, Brits. Most of the world was represented in that room. It was really exciting to see the cooperation that occurred. And I'm really grateful that I understand English, because most things happened in English. Thank goodness. Let's go ahead. When should I go for my CCSVI treatment? Well, we talked lots about that, and we'll get into some of the studies later. The short story, sooner is better. Can I turn the clock back and have it in 1996? Of course I can. Am I grateful that I've had it now, thanks to my mom and people that supported me in the pattern? Absolutely. Okay? There's no question sooner is better. If you think about having a stroke, do you want to have it for a short time or a long time? Do you want to have huge rehabilitation required or short disability required? And if that doesn't ring your bell, how about reduced risk of dementia? I'll be really brutally honest, my biggest fear has always been becoming demented. I've had friends with MS become demented. That's why the one woman hung herself. She knew it was starting. She wanted to do something while she still could. Dementia happens because of lack of blood supply and injury to a part of the brain. And as we'll get onto in another slide, it happens blood vessel based. And probably the biggest piece for understanding dementia is coming right now on the CCSVI information. Remember, we with MS are poster children, but we're not the whole deal. It's bigger than us, quite a bit bigger than us. And then, as some of you have elegantly quoted already tonight, some brain injury may not be reversible. One of the things that disappears when we have MS, and we have this lack of blood supply, is the plasticity of the brain. What's plasticity? It's the ability of the brain to recover, adapt, and take on with new solutions to solve the problem with another part of the brain. When those folks with stroke learn to speak again, it's not because the stroke part got better. They trained a brand new piece of the brain. Once you restore the blood flow to the brain optimally by treating the CCSVI well, now you have a chance of getting your plasticity back, and the brain works at healing itself. Now, you've got to relearn a few things. It's wonderful to have the folks from the MS Society with their very, very good physiotherapists and occupational therapists, and sometimes some really brilliant physical, personal trainers, because they can retrain us. Just as Sandra said, and others have said, we need to relearn to walk, some of us, because we've developed this amazing gait. We throw our hip out to the side and away we go. And the body learned a shortcut because it was a pathway to a nerve wasn't working. It doesn't give up that shortcut easy. You've got to be really stubborn about it. It's almost like relearning to walk again, because you relearned an unusual method. So it can be done, but it won't happen easy. But even for the pieces that aren't reversible, by the plasticity returning, by your fatigue going away, you've got a much better chance. Certainly some of the drugs that we've used to control spasticity, we were wet noodles. One of my good friends in Saskatchewan, she's got a problem transferring now, because all of her spasticity is gone. her transfers were based on spasticity. She's got 2 teenage daughters at home. She still raises them own. She's a single parent. So she can't transfer now. Even though she's not all that big, the home care worker said, you should be in an institution. You can't transfer. Well, do you think she wants to leave her girls, go into an institution because you can't transfer? So she's rebuilding that muscle groups, starting to redo the transfers without the muscle spasticity. Life's not a God-given gift. Your spasticity goes away, but sometimes it has a function for you. It just depends what stage you've been at. Okay, what other illnesses are likely to have CCSVI? I put the top one down because it's high on the list, transverse myelitis. Some of us, when we don't know what we have early on, they've got all these nifty terms. That's another story, but usually they're pre-MS. Let's call them that. Or, as I don't like to call it, limbo. Lots of us are left in limbo for a while. Well, if you're in limbo land, get your CCSVI checked and treated. Because who cares if you get the diagnosis or not? There's nothing special about having an MS diagnosis. I'll bet you they would let me join the MS Society just as a regular person. I wouldn't have to have an MS diagnosis. You're not that tough yet, are we? But anyway, so transverse myelitis, optic neuritis, many of which, of course, go on to MS, but they don't all. But you could treat them way earlier and reduce the injury much, much better by having it treated early. The other suggestion with regard to eyes is often the symptoms suggestive of glaucoma, and my sister was in this group, it's actually your MS due to the back pressure on the veins. So we may start to make a difference on glaucoma patients, some of them, maybe not all of them, but some of them, by treating this. Normal pressure hydrocephalus. Well, that is fairly frequent, actually, and normal pressure hydrocephalus is one of the factors in dementia. Okay? Benign fasciculation syndrome I alluded to earlier with Sandra's son. He hasn't had a fasciculation since his treatment, okay, a couple months ago. And this is a hard word, even for me, and I've tried to practice on it. Leukoariosis. That's close enough. This is where you get white matter lesions in the brain, and you become very anxious, and you start toward dementia, but you don't have MS. But remember the white matter lesions? That sounds like MS, doesn't it? This is a syndrome which is more common than people realize, goes on to dementia, very, very treatable. Treat the CCSVI.